In today's health headlines, why social connection is important for our health, how to be more intentional about the connections we make, and the impact of spirituality within your network during hard times. Joining us now is Dr. Youssef Ransom, Associate Professor of Social Behavior Sciences at Yale School of Medicine. Doctor, welcome. Great to have you.
Thank you for having me today.
This goes without saying. We know isolation can really take a toll on our mental health. So why is social connection so important?
Yeah, so social connection is very important. We are social creatures designed to be in connection with one another. It's the essence of being human. And when we lose those connections, or when those connections are of poor quality, health suffers. And so take, for example, is a study that showed among 143 studies that summarized the findings that social connectedness or stronger social connections was associated with about 50% lower likelihood of mortality. And so what that translates to is, let's say in a hypothetical sample of 100 people, if 50 of those people die, there would be 5 more people still alive who had stronger social connections than compared to those with weaker connections, right? And there are 2 primary ways through which social connections impact both physical health, mental health, and mortality. And one is sort of stress buffering, which is basically that people, when you have connections that help you be able to deal with difficult situations. And then secondly, there's sort of the direct pathway, which is that your social networks influence the type of behaviors that you adopt, the types of lifestyles. And I'll give one sort of practical example. Last year, I was in the emergency room, and there was a patient that was next to me who came in with a severe issue, whether it's dealing with his stomach. And during that time, he asked the nurse whether he can be discharged so that he can go move his car and retrieve his insurance paperwork from the car that he can pay his bill, because apparently he was late. And so the nurse said, well, we can't let you go right now. Isn't there anyone else who you can call to help you move this car or help you retrieve the paperwork? And the gentleman said no. And so imagine being in the emergency room to deal with a acute situation, but on top of that, having to worry about getting a ticket because you didn't move your car, or furthermore, having to pay your insurance, which was late. So we can see here how both being in the ER for this physical condition was also compounded by the stress of worrying whether his car is going to be towed or not. So
Dr.
that's
Youssef,
one way.
Before we go, because we're running a little bit out of time here, can you at least touch on how spirituality can help give us perspective on life's challenges?
Yes, so indeed. So we are facing a lot of challenges. When we think about the deaths of despair, for instance, right, higher rates of alcohol, drugs, and suicides, it's related to purpose in life and a disconnection with work. And so when we think about facing challenges, we want to be able to have individuals within our networks who can help us understand and deal with difficult situations that arise. So that's one way of having spirituality in your network influences your health outcomes.
All right, Dr. Youssef Ransom, thank you so much. Associate Professor of Social Behavior Sciences at Yale School of Medicine. Thank you for being here with us.
Thank you for having me.